Hello, guys. Can you hear me okay? All right, happy Thursday. It is 12:16. Let's get started, folks. And today we're going to start a whole new chapter, chapter 12. Just to remind you, we have one quiz that is open right now, which is the quiz for chapter 11 that we finished on Tuesday, right? And we're going to start and finish that chapter 12 today, which means that the quiz for chapter 12, in fact, is open right now. Both of the quizzes for 11 and 12 are due Sunday night. Okay? This coming Sunday night, both of the quizzes for chapter 11 and 12 are due. And then next week, Tuesday, we have our third exam. So our third exam coming up next Tuesday, just to remind you. Does anybody have any questions, any issues, any problems before we get started? All right, guys. So let's go over chapter 12. And chapter 12 discusses the lymphatic system and body defenses. So half of the chapter is going to be about the lymphatic system. What are the different components of the lymphatic system? What is a lymph? What is a lymphatic vessel? What are the lymphoid tissues and organs? And then we're going to discuss about immunity, our immune system, okay? Which is my favorite system of all the systems. I think the immune system is the most interesting and the most complex. Now, let's start from the basic here. What is a lymph? Folks, a lymph is a clear fluid that is going to travel through our lymphatic system. Now, where does this fluid come from? Where does this lymph come from? And to understand that, we need to go back and talk a little bit more about the cardiovascular system. We just talked about the cardiovascular system on chapter 11. And remember that we have 5 different blood vessels, right? We have the arteries, we have the arterioles, we have the capillaries, we have the veins, the venous, and we have the veins. And this is the sequence in which the blood is going to flow, in that order. Now, when the blood gets to the capillary, guys, everybody look up here for a second. So this little drawing right here is showing the capillary that is embedded in a tissue, okay? And that tissue could be an organ. It could be the lungs. It could be the liver. It could be the spleen. So when the blood gets into the tissue, remember, this is where we're going to have the exchange of gases. We're going to have the exchange of waste. Oxygen gas is going to leave the capillary and go into the tissue. Nutrients like glucose is going to leave the capillary, go into the tissue, and then we're going to have the CO2 and waste going in the opposite direction. It's going to go from the tissue into the capillary. Now, besides oxygen gas and nutrients going into the tissue, guys, there is something else that is going to get out of the capillaries and go into the tissue, and that is water. H2O. So the water, which is found within our plasma in the blood, right? A lot of that water, a lot of that fluid will leave the capillary and go into the tissue. Folks, our tissues are bathed in fluid. We are not dry inside of our body. I'm not talking about blood either. I am talking about fluid, which is mostly water bathing our tissues. Okay? Now, this fluid that is in the tissue, this is what we call the interstitial fluid, also called the tissue fluid. So what is the tissue fluid? The tissue fluid is the fluid that is in the tissue. Now, imagine this, okay? Imagine that we have all of this blood coming through the capillaries of the tissue and all of this fluid, all of this water going into the tissue. After a while, the tissue would be soaked in a fluid. It would be saturated with water. And what's going to happen is to the tissue? The tissue is going to swell up with all the water inside. Guys, imagine you have a sponge, and you take the dry sponge, and you put it into a bucket of water. After a while, the sponge cannot hold water anymore. All right? Now, when that fluid gets into the tissue, we have the lymphatic vessels which will suck up all of that excess fluid. And now that fluid, when it enters inside the lymphatic vessels, now we're going to call that the lymph. So it's no longer called a tissue fluid. Now it has a different name. We call it the lymph. Okay? I have a question here. How is lymph different from plasma? Not by much. There is not much difference at all. It is basically the plasma that is, plasma is called when it is part of the blood. But once it goes into the lymphatic system, now we don't call plasma anymore. We call the lymph. But the composition is pretty much the same. Okay? Now, let me show you what would happen if a lymphatic system is not working properly. This is what it would happen, folks. This is what we call edema. So we can see here the left leg of this individual, and we can see also the left arm of this individual right here. They are swollen. Why are they swollen? They are swollen because there is accumulation of a tissue fluid in which the lymphatic vessels, the lymphatic system is not working properly. Maybe there's a blockage in the lymphatic system, and now the the fluid is accumulating in the tissue. Okay? So, what are the two major functions of the lymphatic system? Number one, the lymphatic system is involved with draining excess interstitial fluid, draining excess tissue fluid. Number two, the lymphatic system is involved in facilitating immune response. Okay? Now, what does it mean by facilitating immune response? It facilitates immune response because we're going to find immune cells within the lymphatic system. We're going to find immune cells in the lymph nodes. We're going to find immune cells in the lymphoid organs, which we're going to be talking about in a little bit. Okay? Now, just to help you answer your question about the difference in the fluid, look, if that fluid is inside the blood vessel, we call it plasma. If that fluid is bathing the tissue and the cells, we call tissue fluid. If that fluid is inside the lymphatic vessels, we call that the lymph. Okay? All right. Now, let's put together here the cardiovascular system with the lymphatic system and also identify different components of the lymphatic system. So let's start with the heart right here. We know that our heart, especially the left ventricle, when it contracts, is going to push blood out of the heart into the aorta. Then this blood is going to go through the arteries, is going to go through the arterioles, is going to go through the capillaries, is going to go through the venules, and is going to go through the veins, and eventually return to the heart in the right atrium. Okay? Now, I also explained to you that when the blood passes through the capillary, we are going to have the plasma leaving the capillary, a lot of the plasma leaving the capillary and going into the tissue. And now this fluid is going to be called the tissue fluid. Within the tissue, we have a little capillaries called the lymph capillaries. And those lymph capillaries, they're going to suck up that tissue fluid and take the tissue fluid inside the lymphatic vessels. So now we're going to call that fluid the lymph. So now we have lymph inside the lymphatic vessels. And the lymphatic vessels, guys, they have valves, just like the veins. Remember when we talked about the veins in the previous chapter? Veins have valves. Lymphatic vessels have valves as well. What are the valves doing? The valves are making sure that the lymph, it keeps moving upwards, going towards the heart. Okay, it's going to help to push the lymph upwards towards the heart. Now, besides the lymph capillaries and the lymph vessels, we also have what we call the lymph nodes distributed all over the lymphatic system. And we're going to take a closer look at these lymph nodes, and we're going to see what we find inside them and what is the function of the lymph nodes. Okay? But I can tell you already that one of the main functions of the lymph node is to check the lymph for the presence of anything that is foreign to our body. If we have a bacteria in the lymph, if we have a virus in the lymph, if we have some fiber in the lymph that shouldn't be there, the white blood cells inside the lymph nodes are going to take care of them, are going to remove them, are going to break them down and destroy them. All right? So in the lymph nodes, we have white blood cells that check the lymph. And outside of what we call the lymphatic vessels, we have the lymphoid organs. And the lymphoid organs are also part of the lymphatic system. And they are part of the lymphatic system because they also have white blood cells inside, they have immune cells inside, and they help to check for the presence of pathogens. Okay? We have one. We have lymph nodes everywhere. We have lymph nodes, and we're going to talk about some of those clusters of lymph nodes, in fact, in the next slide. Okay? So let's take a close look at some of these lymph nodes. And here we have a cartoonish representation of a map of the lymphatic vessels and the lymph nodes in our body. Now, there are several different clusters of lymph nodes. There are three little clusters that I want you guys to know by name. They're some of the most important ones. We have a group of lymph nodes in our neck, folks, right to the side of the neck. And this is why when the doctor is checking you, they are feeling on your neck, not only to see if your thyroid is enlarged, but also to see if you have a swollen lymph node. These lymph nodes here are what we call the cervical nodes. Then we have lymph nodes under our armpits. There is a cluster of them called the axillary nodes. And we have a cluster in our inguinal region, and these are what we call the inguinal nodes. Okay, so these are different clusters of little lymph nodes. Now, our body is divided into two halves, which is going to collect the lymph that is circulating in the lymphatic vessels. We have the right upper section of the body, and all of the lymph collected in this right upper section will be dumped inside the right lymphatic duct. And the right lymphatic duct is situated right around this region right here. And after this lymph goes into the right lymphatic duct, all of that lymph now on the right side is going to enter the right subclavian vein, okay, which is positioned right here. This is the right subclavian vein. Now on the left side, all of the lymph collected in the left side of the body is going to be dumped inside the thoracic duct, and the thoracic duct then is going to take the lymph and send it into the left subclavian vein, which is positioned right over here. Now, where does the lymph goes next? Guys, after the lymph enters the left subclavian vein and the right subclavian vein, now the lymph is going to enter the superior vena cava. And from the superior vena cava, now the lymph is going to go inside the right atrium of the heart. And once the lymph goes into the right atrium of the heart, it's going to mix back with our blood. And it's very important that we get that fluid back. Otherwise, our blood volume would drop dramatically and we could die because there's a lot of this fluid that we lost from the blood, the plasma in the blood that is now in the lymph, and this fluid needs to return to the blood. Okay? And it's going to return to the blood once it enters the right atrium of the heart. Why is it not divided more equally? That's a good question. Scientists couldn't really fully understand what is the evolutionary reason why we have this unequal division of the right and the left side of the body. Okay? All right, so let's take a look inside the lymph node now. And so here we have a little lymph node that is cut right open. And I want to show you guys that we have all these lymphatic vessels bringing lymph inside of the lymph node. These are what we call the afferent lymphatic vessels. And then on the other side, we have these lymphatic vessels that are taking lymph out of the lymphatic node, of the lymph node. And these are what we call the afferent lymphatic vessels. Now, I want everybody to look up here, please. Can you see how we have a more afferent lymphatic vessel bringing lymph in than afferent lymphatic vessels taking lymph out? The question is, why? How do you think that serves us? Why do we have more afferent bringing lymph in than afferent taking lymph out of the lymph node? What do you guys think?
The afferent will slow down the flow.
Absolutely. Absolutely. By having less lymphatic vessels taking lymph out of the lymph node, it will slow down the flow rate of the lymph through the lymph node. Why do we want to slow down the rate of the lymph passing through the lymph nodes?
To avoid accumulation.
For what again, Larissa?
To avoid accumulation of unhealthy lymphs. To keep it in
No,
balance.
no, not to avoid accumulation. Something else. Why? Why slow it down? Guys, what we have inside the lymph nodes, we have white blood cells, right? What are they doing? They're checking the lymph.
Macrophages.
What about them? What about
They
the
fight
macrophage?
viruses and bacteria.
They clean up. They clean up.
Right,
Clean.
it's so that so that there is enough time for the white blood cells, like the macrophages, to check the lymph for the presence of anything that is foreign in the lymph. Look, if there was the same number of afferent and afferent, the lymph would go in and out of the lymph node immediately. It wouldn't stay there any time at all. Now, by slowing it down so the lymph stays longer inside of the lymph node, it gives time for the white blood cells to check the lymph, make sure there is nothing that shouldn't be there. Okay?
They can go through walls.
All right, moving on. Let's talk about the lymphoid organs now. And again, what are the lymphoid organs? Lymphoid organs are organs that contains white blood cells. They contain immune cells that's going to help to protect us. One of those lymphoid organs are what we call the tonsils. Guys, look at the position of the tonsils. We have talked about the tonsils before. Look, we have tonsils all over our pharynx. We have tonsil in our nasopharynx. We have tonsil in the oropharynx. And look, everything that we eat, everything that we inhale is going to pass against the tonsils. So our tonsils, which contains white blood cell on the inside They are checking for the presence of anything that it shouldn't be getting into the body. So it's like a gatekeeper for our body in a very, very, strategic location. Then we have right on top of the heart, we have what we call the thymus. And we're going to take a closer look at the thymus and see the function of the thymus in a minute. Right next to the stomach on the left side of the abdominal pelvic cavity, we're going to find the spleen. We're also going to take a look at the functions of the spleen. And then embedded in our small intestine, we have a little lymphoid organ, lymphoid tissue called the Peyer's patches. What are we going to find inside the Peyer's patches? We have white blood cells, and they are checking to see if there are any pathogens inside of the small intestine. And then at the entrance, at the beginning of the large intestine, we have that little finger-like structure that we used to think was good for nothing, just good to become inflamed, burst, and kill you, because that's what can happen. And that is what we call the appendix. But the appendix it does have a function. And the function of the appendix is that, again, we have white blood cells in the appendix, and they are checking for the presence of pathogens at the beginning of the large intestine. Okay? Now, the tonsils, the Peyer's patches, and the appendix, they belong to a subgroup of the lymphoid organs called the MALT, the mucosa-associated lymphoid tissue, because these are lymphoid tissue associated with the mucous membrane, with mucosa. Okay? All right, let's take a look at the thymus. And the thymus is mostly active at the beginning of our life when we're still a child, because as soon as we reach puberty, and then by the time that we are in our 50s and 60s, the thymus is really not functioning at all. The thymus, in fact, has shriveled and is just a little, adipose tissue. It's not really doing much of anything at all. Most of its function is already done by the time that we are, in our mid-teens and, late teens. Okay? Now, what is the function of the thymus? The thymus function is for the maturation and propagation of a very important immune cell called the T lymphocyte, aka the T cells. And we're going to talk more about the T cells today. And the way that the thymus can do that is by secreting a hormone called thymosin. And thymosin helps with the maturation and proliferation, propagation of the T cells. Now, we have talked about the thymus before when we talk about the endocrine system. So the thymus not only belongs to the endocrine system, but it also belongs to the lymphatic system as well. Okay. I have a question here. Can all these organs be removed from you and still operate okay? Um, Not really. Depends on the organs. Yes, you can have your tonsils removed. Usually, you don't have all the tonsils. Usually, you have the tonsils that are in the oral pharynx removed, especially if you have, repeatedly tonsillitis, inflammation of the tonsils. Removal of the tonsils could lead to an increase in asthma. There's studies that have shown that. The thymus, if it is later in life, yes, it could be removed because the function is mostly done. When we get older, the function decreases dramatically. We cannot remove the spleen. We need the spleen. The spleen is very important.
Can you guys hear me now? Okay. Sorry about that. All right, Theo, I don't know if you heard any of my answer, but you could remove some of those organs. For example, the tonsils, you could have removed. You could remove the thymus, especially if you are already of a older age, because most of the function of the thymus is done by then. But some of those other organs, like the spleen, is essential. Okay, you definitely need them. Right. All right, moving on. Let's take a look at the spleen now. And the spleen is one of the biggest in terms of mass, a lymphatic tissue that we have in our body. And what is the function of the spleen? One of the major functions of the spleen, folks, is that the spleen helps to filter and cleanse our blood. So if we have bacteria in our blood, if we have viruses in our blood, if we have anything that does not belong to our blood, once the blood passes into the spleen, in the spleen we have macrophages, and the macrophages are going to do phagocytosis and is going to destroy whatever is foreign inside of our blood. Very, very important function. Second function of the spleen, which we have talked about before, is that remember the spleen is also involved with the recycling of old worn out red blood cells. Remember that the globin in the hemoglobin is going to be recycled into amino acids so that we can reuse those amino acids. The iron in the heme is going to be sent to the liver and also recycled. And the rest of the heme cannot be recycled and is going to be transformed into bilirubin. The bilirubin is going to be sent into the liver, and then the liver get rid of the bilirubin through our feces and our urine. Now, what happens if the liver is not working properly? Now, bilirubin accumulates in the liver and the blood, and we develop what is called jaundice. Okay? I have a question here. Bile, yes, bile, part of the bile is made from bilirubin. Okay, so bilirubin and bile is not the same thing. There is part of bile is made from bilirubin. Okay. All right, guys. So let's focus now on the immune system, and we're gonna discuss about our immunity. And I want you guys to understand that we have two main branches of our immune system. We have what we call the innate immunity, also called the inborn immunity, and we have what we call the adaptive immunity, also called acquired. Folks, what is the difference between the two? Look, the name says it all. Inborn immunity, we are born with it. Can anybody give me an example of a part of our innate immunity that we are born with? When you look at someone, you see it right away. Our skin. Our skin is part of our innate immunity because our skin, folks, an unbroken skin is not going to allow anything to penetrate into our body. Are we born with a skin? Yeah, we are. We don't need to develop one. Okay? And also, our skin is non-specific. What does it mean to be non-specific? It means that my skin doesn't care if it is a bacteria, if it is a virus, if it is a fungi, if it is an E. coli, if it is COVID-19, it will protect me exactly the same way. It's not going to be any better. It's not going to improve, but it's already there and it's non-specific. Adaptive immunity, we need to acquire. Can anybody tell me how do we acquire adaptive immunity?
Exposure.
Getting vaccines.
Environmental responses.
Environmental responses. You got to be more precise with your answer, Larissa. With exposure, like yes, vaccines, just getting sick. If I get sick with a flu or a cold or the COVID-19, I will develop acquired immunity against those pathogens. Okay, this is what acquired mean by being exposed to something, to a vaccine or to the flu virus. Now, the adaptive immunity then is specific because when I develop antibodies against the pathogen, folks, those antibodies only work against that pathogen, nothing else. So it is specific to the pathogen, okay? So let's take a look at the innate immunity first, and then we're going to take a look at the adaptive immunity. And the innate immunity includes what we call the first line of defense and the second line of defense. The first line of defense is also called the external defense. The second line of defense is also called the internal defense. Both of them we already have. We don't need to develop. We don't need to acquire. So an example of a first line of defense, which is the external defense, is the epithelial layer of our body, our skin, the lining of my digestive tract, the lining of my respiratory tract. These are physical barriers against anything that is foreign to our body. The mucus that we produce and the mucus that we have in our esophagus, in our trachea, in our stomach, in our small intestine, that mucus is going to trap pathogens, and then we have ciliated cells, remember, in the trachea, which is going to push the mucus upwards so we can get rid of it. Our tears and saliva contains an enzyme called lysozyme that helps to break down the cell wall of bacteria. And also the gastric juice inside of our stomach is very acidic. And anything that gets into the gastric juice, any pathogens, will be killed, will be destroyed. Okay? Now, what about the second line of defense? What about the internal defenses? Among the internal defenses, we have a group of cells called the natural killer cells. I love that name. It's like a movie coming up in theaters, the NK cells. And the NK cells, the way that they kill pathogens is by releasing a little cytotoxic enzyme called perforin. So perforin is going to lead to little holes on the cell membrane of pathogens. Inflammation. Inflammation is part of the internal defense. Nobody likes inflammation. Inflammation has a bad rap, just like cholesterol. And I want to change that. We need inflammation, folks. We need inflammation to heal. When you cut yourself, if you don't have an inflammatory response, that wound will never heal. And this is one of the things that happens, for example, with people that has type 1 diabetes. Have you ever heard of diabetic foot? So what happens is that when you have diabetes, your inflammatory response goes down, and that leads to a difficult time healing the tissue. Okay? Inflammation initiates the process of repair and healing. Without inflammation, we can't heal our body. Phagocytes. Phagocytes are special white blood cells that can take pathogens inside and destroy them. They can do phagocytosis. Antimicrobial substance. We're going to talk about two different types in a little bit. One that is targeting bacteria, the other one targeting viruses. And fever. Yes, fever. Fever is also part of the internal defense. Now, what about high fever? Is high fever dangerous? Yes, it is. Okay? Why is it dangerous? It is dangerous because a high fever, high temperature can denature the proteins in our body. And if the proteins are denatured, they're going to be malfunctioning. They're not going to be functioning at all. Now, for the parents, the moms and the dads out there, if your child has a low-grade fever, let it be. Don't give them any medication to stop the fever. The fever is doing its job. The fever is helping with the defense of your child. Okay? But again, if the fever increases and then becomes sustained, by any means, do give medication and take it to the doctor. But a low-grade fever is a good thing to help them heal, to help them get better.
Natural.
Inflammation. Let's talk a little bit more about inflammation. And inflammation involves several different steps in our body, like I said, that is going to help activate the immune system and help with the process of healing. One of the processes that is initiated with inflammation is vasodilation. Let's say, guys, you guys were walking barefooted, at the beach, and then we have a little nail that got stuck on your foot right here. Ouch. Now, what's going to happen? Well, there was some bacteria on that nail, and now the bacteria is inside your body, inside of your skin right here. Immediately, as the nail penetrates the skin and breaks down tissue and breaks down cell, the dying cells, they're going to release cytokines. They're going to release little chemicals. Those chemicals are going to lead to the vasodilation of the blood vessel, and also is going to increase the permeability of the blood vessel. Meaning what? Meaning that it makes it more easier for things to get out of the blood vessel and go to the site of the inflammation, of the infection. Now, we also talked about the fact that white blood cells can do something called the diapedesis, which is literally squeeze themselves out of the wall of a blood vessel and migrate to the site of inflammation, of infection. Now, how they know, guys, how do they know where to go? They know where to go because of something called positive chemotaxis. What is positive chemotaxis? Positive chemotaxis is little chemicals released by the bacteria right here, and those chemicals are going to attract the white blood cells. And they are going to literally migrate towards the bacteria. I'm going to show you guys in a little bit a video, a short little video, showing a neutrophil, which is a phagocytic cell, chasing a clump of bacteria in our blood until the neutrophil catches the clump, take it inside and destroy it. Okay? All right, so let's take a look at the phagocytosis. We already know what phagocytosis means. Phagocytosis is the capacity of a white blood cell to engulf pathogens, take them inside, and destroy them. Now, how do they destroy those pathogens once they take them inside? They destroy them by sending the little pathogens into the lysosomes. Do you folks remember the lysosomes? These are little organelles inside of the cell that contains lysozyme, and they have an acidic pH. So when the pathogen is in combination with the lysozyme and the acidic pH, that is going to lead to the destruction of that pathogen. Okay, so that's what phagocytic cells do, like macrophages and like neutrophils. So let me show you this little video here. It's a really short, really cool video that shows you that when I say that the macrophages and the neutrophils, they chase after bacteria and engulf them, I am being literal. Okay, so let's watch this little chase scene right here.
Neutrophils are white blood cells that hunt and kill bacteria. In this spread, a neutrophil is seen in the midst of red blood cells. Staphylococcus aureus bacteria have been added. The small clump of bacteria release a chemoattractant that is sensed by the neutrophil. The neutrophil becomes polarized and starts chasing the bacteria. The bacteria, bounced around by thermal energy, move in a random path, seeming to avoid their predator. Eventually, the neutrophil catches up with the bacteria and engulfs them by phagocytosis.
There you go, guys. Now in slow motion now. So if you missed it. So you can see now what I mean by chasing that bacteria, okay? Now, how can it chase it? It can chase it because of positive chemotaxis, because of the chemicals that are released by the bacteria that are actually attracting the white blood cells towards it. I know, right? All right, guys, so let's take a look at the antimicrobial. So I have a question here. How does it know not to engulf other material? Because the other material are not releasing the same chemicals, right? They are attracted to the chemicals released by the bacteria, which is not the same chemicals released by other stuff that is in there, okay? All right, so let's take a look at the antimicrobial proteins now. We are still talking about the innate immunity in the second line of defense, which is the internal defenses. And one of those antimicrobial proteins is a group of proteins called complement proteins. These proteins, guys, we have them already in our blood. We are born with them. And when these proteins find a bacteria, and they're going to see little antigens, little surface markers on the bacteria, the proteins will recognize those surface markers. It will bind to them and will create little channels on the cell wall of the bacteria. Now, these channels right here, what's going to happen? What's going to happen is that water, fluid, will enter inside of the bacterial cell, and the little cell is going to swell up and eventually is going to burst, is going to lyse, and that is going to kill the bacteria. Okay? Another antimicrobial protein that is involved not with bacterial targeting, but viral targeting, are proteins called interferon. And interferon, what they do is that they are going to interfere, hence the name interferon. They're going to interfere with the propagation, with the replication of viruses inside the cell. Guys, interferons are so good that actually scientists, they created synthetic interferons that are used for viral infection. When you have a viral infection and you need medication to help to get rid of the viral infection, most likely your doctor will prescribe an interferon, okay, which is going to enhance the destruction of the virus inside of the cells. All right, so far we have talked about the innate immunity. Now, let's make a little comparison here between the innate and immune and adaptive, and then we're going to go further into the adaptive immunity, okay? Number one, innate immunity includes the first and the second line of defense. Adaptive immunity includes what we call the third line of defense. Guys, pathogens don't have an easy life. In order for them to infect us and cause us to be sick, they have to jump through a lot of hoops. So if you wish to be a bacteria in your next life, don't. They have a hard life, okay? They have to jump through all this line of defenses in order to be able to infect us. Now, innate immunity is non-specific. Once again, it does not care what type of pathogen it is. It's going to act always the same intensity, always the same effectiveness. It's not going to get any better or any worse. Adaptive immunity, however, is highly specific. As I mentioned earlier, an antibody that is generated against a specific virus can only bind and destroy that virus, nothing else. Innate immunity has no memory. My skin does not remember that I was infected by the COVID-19 virus in 2021. It doesn't know that. It doesn't remember that. But my adaptive immunity does remember. Because once we develop antibodies against the specific antigens, we're also going to develop long-term memory. We're going to have a memory B cells. We're going to have memory T cells. And those cells are going to stay behind. If I am infected again by the same virus or bacteria, then my response is going to be better. This is why we vaccinate. people, folks. Vaccine generates antibodies, generates long-term memory against that specific pathogen. So that when you are infected by the pathogen for real, your body will be ready. The response is going to be stronger. The response is going to be better and more effective. Because the innate immunity, yes, it is fast at the beginning, but it is always the same intensity. Like I said, it does not get better after exposure. Now, the adaptive immunity at the beginning is slow because we need to develop antibodies, we need to develop memory cells. But every time beyond the first time that we are exposed, the intensity will be greater, will be faster, will be better. Okay? This is why vaccines are so important. I am a huge proponent. I'm a huge, what is the word? Proponent of vaccines. I know that especially after the COVID-19, there was a huge blowback, against vaccines. This administration that we have right now are anti-vaccination. We have as the head, sorry to talk about politics, but it makes me so furious. We have as the head of our health system a guy that is an environmental lawyer. Think about that for a second, okay? Who am I talking about here? I'm talking about Robert F.K. Jr. Robert F.K. Jr. he has a degree in environmental law. That's his expertise, whatever that might be. He is heading our healthcare system. He has zero background in medicine. He has zero background in research. None. Zero. Now, let me ask you this question. Let's say that you have a kid and your kid is really sick. Are you going to take your kid to see your plumber? No, nothing against plumbers. They are great doing what they do. Okay? But they are not very good with medicine or getting your kid feeling better. That's how insane things are right now. What about vaccine testing? What about vaccine testing? Vaccines are tested to no end. I'm an absolutely big proponent of vaccine testing, and every vaccine that is out there, they have been tested. If you hear otherwise, that is fake news on Instagram or Facebook. Now, so let's keep going right here. So we finished the talk about innate immunity. Let's focus now on adaptive immunity. And adaptive immunity also has two different brands or two different branches. We have what we call the cell-mediated adaptive immunity, and we have what we call the antibody-mediated adaptive immunity. Cell-mediated involves what we call the T cells. Hence the name cell-mediated, because the T cells will directly attack and destroy pathogens. Antibody-mediated, they involve the B cells because B cells transform into what we call plasma cells that produce the antibody. Okay, so one branch of the adaptive immunity is going to use the T cells to kill pathogens. The other branch, they're going to use antibodies to tag and destroy those pathogens. Okay. Now, before we talk more about the T cell and B cell, let's go back and discuss about antigens, which we have discussed already when we talked about the blood. Remember, guys, antigens are also called what? They're also called surface markers. Antigens are little proteins, glycoproteins on the surface of a cell. They stuck to the cell. Okay? Now, there are two different types of antigens. We have what we call non-self antigen, and we have the self antigen. What is the difference between non-self and self? Non-self doesn't belong to my body. So anything that enters my body and causes an immune reaction, it causes the activation of my immune system, they are what we call non-self antigen. For example, bacteria, viruses, fungi, parasites, pollen, peanut, for some people can be a non-self antigen. Anything that elicits an immune response and is foreign to my body is what we call a non-self antigen. Now, what about the self antigens? The self antigens, they are part of my body, like the ABO blood group type, like the RH blood group type. These are all self antigens, okay, because they belong to my body. Now, I have a question for you. What if my immune system, my immune cells, look at my self-antigens and start to attack them? What type of disease is that called, guys? What is the name of the condition, the disease, the group of diseases, in fact, in which my immune system starts to attack and destroy
That's
myself?
autoimmune.
Autoimmune. Absolutely. Okay. So an autoimmune disease is when my immune cells look at the self antigens and see them as being foreigner, and it starts to attack and destroy them. Okay. There's another type of antigen called a hapten. What is a hapten? A hapten is a very small antigen that by itself is non-immunogenic. What does it mean to be non-immunogenic? It will not activate the immune system. But for some people, those haptens, they can bind to specific proteins. And when they bind to those proteins, now they become highly immunogenic. Let me give you an example. Most of us can take aspirin and we're going to be fine. It's going to help with our headache. That's about it. But for some people, if they take aspirin, they can die from an allergic reaction because there are chemicals in aspirin that will bind to specific proteins in those individuals, and now that is going to cause a hyperactivity of their immune system. And they're going to have a very strong reaction against it. Okay? Any questions so far, folks? All right. Now, let me talk about something called, cells called antigen-presenting cells, also called the APCs. And I need everybody's attention here so that you understand what APCs are. Okay? APCs, guys, antigen-presenting cells, are white blood cells in our body that can recognize antigens. Then, after they recognize antigens, specifically talking about the non-self antigens, okay? They're going to take those antigens inside of the cell. They're going to destroy those antigens, and they're going to take a little piece of the antigen and present it at the surface of the cell. Hence the name antigen presenting cell. Now, who are they presenting that antigen to? They are presenting that antigen to other white blood cells because those other white blood cells cannot see the antigen on their own. Guys, let's say that I have a bacteria right here in my body, okay? And here we have a T cell, a T lymphocyte right here. This T lymphocyte, if it has not been activated, if it has not been presented with an antigen by the APC, it will swim by this bacteria here and is not going to do anything at all. It's going to leave the bacteria alone because it does not recognize that bacteria as something that is foreigner and dangerous. So how do we activate this T cell right here? Well, let me tell you. We're going to have cells like dendritic cells and macrophages. They are going to engulf this bacteria. They're going to take it inside of the cell and destroy them. They're going to take a little piece of the bacteria and they're going to stick it into a cell surface presenter. They're going to present that little antigen to the T cell. And now, when this antigen is presented by the dendritic cells, by the macrophages, by the B cells, now this T cell right here will become activated. And when it comes across the same bacteria, is going to come in here and release cytotoxic enzymes that will kill the little sucker right here. Okay? Now, can the T cells do that without being presented by the APCs? No, they cannot. So you can see how important APCs are. So APCs, they engulf the pathogens, destroy them, and present a little part on its surface so that other white blood cells can recognize the antigen, can become activated, and they can hunt after those pathogens. Is that clear, folks? Killer T cells are like the military. In what way, Larissa? So, yes, they destroy pathogens by releasing cytotoxic enzymes. Okay. All right, guys, moving on. Let's take a look now at where T cells and B cells come from. And remember, T cells and B cells are blood cells. Where does all the blood cells come from? The red bone marrow. So let's see what happens with the T cells and the B cells after they are formed in our red bone marrow. They're going to take a very different path in life, okay? So here we have a little T cell right here, and we have a little B cell. And those T cells and the B cells, they are formed from the hemocytoblast. Remember, the hemocytoblast is a blood stem cell. Okay? So they're going to be formed inside the red bone marrow. Now, the T cell are like those independent, adults that when they reach maturity, they are going to pack their bags and they're going to leave the parents' home. And they're going to go to the thymus. And once they get into the thymus, they're going to leave there for a little while. This is where they're going to become propagated, where more of the T cells are going to be formed. And this is why they are called T cells, by the way, folks. T is for thymus. Okay? Now, the little B cells are like those adults that are still not really cutting the umbilical cord, right? So they decided they're going to just stay home. I mean, I'm not judging anybody. I'm not judging the B cells or the T cells. You do you. You do what you want to do. So the B cells, what's going to happen is that they are going to mature and they're going to stay in the bone marrow. And this is why they're called B cells. B is for bone right here. Now, eventually, the B cell says, you know what? Okay, maybe I am 40 right now. Maybe it's time for me to leave home. And what they're going to do is that they're going to leave the B cells are going to leave the bone marrow. The T cells are going to leave the thymus, and they're going to migrate to the lymph node right here, folks. And this is where they're going to stay for a little while. What are they waiting for? They are waiting to be presented by the specific antigen by an APC. Once we have an antigen, a non-self antigen that is going to be presented by an APC, now the little T cell and the little B cell, they're going to be super excited. And now they're going to become activated, they're going to become mature, and they can fight their own fight. They can fight the infection on their own. Okay? They can chase after the pathogen and kill them. The T cell is going to kill them by releasing cytotoxic enzymes. The B cells are going to kill them by producing antibodies. Okay? All right, moving on. Let's take a look now at how B cells propagate and how B cells produce antibodies. Folks, I love asking questions about this in the exam, FYI. And I need everybody's attention here so you understand what's going on. Okay? All right. Folks, here we have three different B cells. We have a B cell number 1. We have B cell number 2. And we have a B cell number 3. We can all see that these B cells are different from one another. Look at the little surface marker here, guys. This one is green. This one is dark blue. This one is light blue. They're all different. Okay? What does it mean to be different? It means that they are specific to one antigen only. Only one antigen is going to be able to bind to that specific little receptor right there in the surface of the cell. So here we have, let's say one day, we have a bacteria right here. We can see the little sphere here is a bacteria. And this bacteria has antigens that is specific for this B cell number 2 right here. So we can see the little antigens binding to the cell surface receptor right there. Now, there's no binding with B cell number 3. There is no binding with the B cell number 1. Only the B cell number 2 becomes bound to the antigen. Once the antigen binds to the cell surface receptor, guys, now we're going to have the activation and the propagation of that specific B cell. Now they're going to multiply, they're going to divide. This is what we call clonal selection. So we are selecting for one specific B cell, and they're going to form many more of them. They are like little clones of each other. Most of the B cells that became activated, they are going to be transformed. They're going to change into a different cell called a plasma cell. And some of them will stay behind as memory B cell. Now, what is the plasma cells? What do they do? Plasma cells produce antibodies. Right here. Okay? So these antibodies here, guys, if you look at it, these were the little cell surface markers right here, the cell surface receptors right there, in which the B cell, after it became the plasma cell, it literally shook off all of those little stuff that was stuck on the surface, and now they're going to circulate in our bloodstream. These are the antibodies. Now, let's say, so this here, guys, is the primary response. What does it mean, the primary response? The first time that this specific bacteria came into our body. Let's say 2 months later, the same bacteria came back and infected me. This is what we call the secondary response. Now, this response is going to be much stronger. This response is going to be a lot faster. Look at this. Now that we have already memory cells in place that is going to remember that antigen, we are going to produce a lot more clonal plasma cells, which is going to produce a lot more antibodies. So the response is going to be better, stronger, faster. Okay, and again, this is why we vaccinate. When we vaccinate, we are doing this primary response right here. We are going through the primary response. We are priming our body against that specific pathogen. So that in the future, when we get sick, we get infected by the same pathogen, our body is going to be ready and it's going to be able to respond better. Okay? Any questions, guys?
Does exposure not enough?
Say it again, Angelica.
Does exposure not enough?
The first exposure?
Yeah.
I mean, it is enough if you never come across the same pathogen. I mean, what does enough means, right? It is enough to take care of that primary infection. Let's
Mhm.
say if you have a virus, or sorry, that you are vaccinated, you are going to have a primary response, but you don't really have the pathogen in your body, so you're going to be fine. Now, let's say that I don't know how many of you got COVID-19. I remember when I got COVID-19 the first time. It was already, I don't know, years later after, I was so proud of myself that I didn't get, so many people got COVID-19. I didn't get it until 3 years later. That's when I first got it. I was sick like a dog. Okay, I was really sick. So because that was my primary response, right? And my body wasn't really ready for all of that load of the virus in my body.
I
But
had the
then when I
same
got,
thing.
right, it's the same thing.
Yes.
When I got infected the second time, I think I got sick like for a day. The next day I was feeling better because again, the
Yeah.
response was much stronger.
Yeah, and then I haven't got any vaccination from COVID-19, so I don't know what's gonna happen to me in the future. So that's why I'm
Did
curious.
you get sick though? You
I
got sick with
did.
a, okay,
Yes, I
so
was sick.
I mean, pretty much you are vaccinated because you
Yes,
got
that's
sick. Now, the thing is, though, is that there are different strains of the virus, right? Just
right.
like the flu virus. Why do we get a flu shot every year? Because the virus mutates. And the antibodies that you develop from the vaccine that you got last year is not going to protect you against the mutated virus of this year. Okay,
Okay, thank you.
you're welcome. All right, so let me show you here a graph, folks, that represents what I just described to you. Everybody look up here for a second. So in this graph here, on this axis, we see antibody titer, or the concentration of antibody in our blood, okay? And in this axis here, we see days after exposure to a pathogen. In the blue, we have a specific antibody called the IgG antibody. In red, we have a different antibody called the IgM. Let's focus on the IgG antibodies. So let's say here at day 0, you got exposed with the COVID-19 virus. We can see right here, a few days later, you start to develop antibodies against the COVID-19. Now we can see there wasn't a ton of antibody. There was a few antibody. Maybe you got sick for a little while because there wasn't a very strong primary response. All right, so let's say a month later, you got exposed again. You got better, right, the first time. A month later, you got exposed to the same COVID-19 strain. Look at this response now, guys. Look at the IgG antibody. We're going to have this huge production of antibody, and the antibody level is going to drop, but it's not going to drop back to 0. It's going to stay elevated. What if you get exposed a third time? This is the response. What if you get exposed a fourth time? You got the idea. Okay? The more we are exposed, the better the response. Right? Now, the last thing I want to talk about, the difference between naturally acquired and passively acquired active and passive immunity. So let's understand the active first, and then we're going to talk about the passive. Okay? First of all, what is naturally acquired? Naturally acquired means that you acquire that immunity naturally by getting sick, for example, by being exposed in the environment. Now, artificially acquired, this would include vaccines. So this is an artificial exposure to that specific pathogen. There is a difference between the two, okay? Now, what is active acquired immunity? Active means that there will be antibody production in your blood. There will be the production of memory B cells. So again, even vaccines will develop antibody and develop memory B cells. This is active. Now, what about a passive acquired immunity? In passive acquired immunity, guys, there is no antibody production. There is a transfer of antibody from one individual to another. Let's look at the passive naturally acquired immunity, okay? Breastfeeding is a perfect example of passive naturally acquired immunity. Breastfeeding is a normal, natural process, right? And when the mother breastfeeds the baby, folks, one of the things that the mom is doing, it is passing her antibodies to the baby. Remember, when a baby is born, the baby has zero acquired immunity. They have innate immunity that we are born with, but they don't have acquired immunity. So what is going to protect the baby at the first days of life? Breastfeeding will, because of the transfer of antibodies from the mother's milk into the baby. Okay? So there will be a transfer of antibodies, but there is no memory because there was no infection. So there is no development of memory. Now, what about a passive artificially acquired immunity? An example of that is a treatment called an immune serum. Let me give you an example of immune serum treatment. I don't know if you folks remember, again, let's use COVID-19. At the beginning of the COVID-19 pandemic, doctors and scientists, they were panicking because we had no treatment, no vaccine, no drugs to treat patients with COVID-19. And one of the things, though, that the doctors decided to do and to test was to do this. Wait, let's take antibodies from a person that had COVID-19 and they recovered, right? So now they develop antibodies in the blood against the COVID-19. Let's take those antibodies, isolate them, and then give the antibody as a shot to a patient that is very sick with COVID-19. And this is what they did, and it was very successful at the beginning of the pandemic, before the vaccine. Okay, they were treating patients with immune serum with antibodies from other patients that had recovered from the COVID-19. So again, you can see there was a transfer of antibody, but there was no memory because there was no active infection. Okay, so this is what we call passive artificially acquired immunity. Any questions, guys? Is it true that baby saliva can influence the antibodies in the breast milk? Yes, there can be some effect on it, but it's not going to destroy the antibodies by any means. Okay? Any other questions?
It's there I remember when I was a kid they given us the polio, the ones that they
The
put it in your
drop?
mouth.
Uh-huh.
Yes. Is that
Uh-huh.
considered immune serum?
No. That's not an immune serum.
Oh.
That is just a regular vaccine that contains the antigen against the poliovirus. Okay? Because there are different types of vaccines that can be delivered in different ways. So you can have a vaccine that is injected. You have a vaccine that is actually pumped into your nose. There is vaccines that you can put in your mouth. Oral, just an oral delivery of the vaccine. Any other questions, guys? All right, folks. Great discussion. So we are done with another chapter. Chapter 12 is in the book. Reminder, the quiz for chapter 12 is open right now. Both quizzes are due by Sunday nights. And next Tuesday, we have our third exam. Okay? All right, guys, enjoy your long weekend, and I'll see you guys next week. Thank you.